This is our new stat pack that will be in our ALS red first response bag. I'm going to go over the contents briefly here. In the first flap, you'll find our IV supplies. We condensed our IV pouch into this med bag. So you'll see in sequential order, we have all of our IV catheter needles, 2 of the 20 gauge and 2 of the 18 gauge, as well as 2 start kits and 2 pigtails behind here. You are allowed 2 attempts, and if you can get bilateral IVs, you win a trophy. There will also be 1 flush here, and there are other flushes throughout the bag, but this one's here in the event you are starting 1 IV. Up top here are your relatively benign medications. We have 2 Zofrans because Region's first loading dose Zofran is up to 8 milligrams. And you have your Benadryl and nitroglycerin. The nitro is here as kind of a cue to attempt an IV before you start giving nitro in the event that you tank your patient's blood pressure. Then you have IV access and you can refill the tank if needed. Not required, but a simple cue. You open the next flap, and in here it looks kind of messy. Bear with me. There's 2 IV drop sets, a 500 bag of normal saline, and a 250 bag of 10% dextrose or D10. We will not be giving D50 here at Roseville Fire. We will be giving dextrose 10%. It's the preferred route. You can titrate it to patient effect, and it's what Alina also uses. In here also, in the realm of diabetes, is your oral glucose and glucagon. This is a good spot for glucagon, but sometimes it doesn't come in this box. So if it does come in the box, please put it in this section. This is also where the aspirin is going to live, only because I don't have a better place for it. And in the meantime, until we exhaust our supply, this is where we will keep our nasal spray Narcan, the 4 milligram spray that we currently have. We will be using this until we are out, and then we will switch to our new Narcan, which I'll show you in just a minute. In the last fold of this pouch is all the rest of the medications we'll be carrying. As I explained in one of the other videos, we'll carry 4 epinephrine's, 3 of which are dedicated for cardiac arrest. Typically we're working arrest for about 30 minutes, which is 3 rounds of epi per Region's guideline. Our guideline differs from Alina's, so just know that there could be a change in frequency depending on if we're running the arrest or if Alina comes and they're running the arrest. This 4th one is simply for anaphylaxis. If we're in the event we catch a medical or a allergic reaction on the way back from a call, we still have one that we can use. Next, you'll find your amiodarone. It's 150 per 3 mLs. Your first dose for an arrest would obviously be 300, which is 2 vials. We carry a 6 ml syringe for this now, and then your last one is 150. These are going to be new to some of you. This is pre-fill adenosine. Region's guideline, you are allowed to start your dosing at 12 because 4 typically never works, and so you can give 12 twice. You give 12, if it doesn't work, you give the second 12. Next, below that is your Atrovent and albuterol. You have to look very closely at these. Up top, and I hope to make this common practice for our department, you can tell that there's an A written on the top tab. You should take a Sharpie and you should highlight that A and then make it visible when you put it in this pouch so people know that that's the albuterol that they can give. Our EMTs can give albuterol. They cannot give Atrovent or ipratropium bromide. So just know that there is a difference, and we should try and make it easy on our folks and try and highlight that A. It'll also make it easier when you're doing your rig checks in the morning to easily identify it. So just help each other out and do the right thing. Down below here would be the secondary spot for glucagon in the event it doesn't come in this box. This is just a placeholder for now. We will not be carrying 2 sets of glucagon, but I wanted to show and demonstrate that that's where that's going to live. When we don't have glucagon in those spots, that is where our double dose of Narcan is going to live. So these have to stay together in order for us to administer them. I would like them both to live in these bottom strands down here, and that's where those will go. And in this last fold in the mesh compartment here is everything that you can use to administer medications and draw out medications, as well as the flushes that we will carry. So we have pretty much 2 of everything, 2 nasal atomizers, Please do not be reckless with these. They are expensive. They're about $7 a piece. Obviously, we have a cost of doing business and we have a responsibility of taking care of our patients, but do not waste these if possible, please. We have our blunt tip needles. We have regular intramuscular needles, 2 1 ml syringes, 2 3 ml syringes, and 2 6 ml syringes, as well as 3 flushes because we have 3 cardiac arrest epis that we will be administering. That's all I have for this medication pouch. Again, we condensed our IV supplies into this pouch, so we eliminated that one, and this is going to be our new IV and medication supply bag. Thank you.